Hi there, my name is Dr. Rahul Desai. I'm a musculoskeletal and interventional and regenerative radiologist. I've been experienced in regenerative medicine for about 15 years. One of the newest things that we've been looking at that's very exciting is red light therapy. Red light therapy is a passive energy-based medicine therapy that helps cells become more vibrant, become healthier, and facilitates healing and general wellness. It's a passive, meaning you don't have to do anything. You get to sit in front of light panels or LEDs, which emit specific wavelengths of light. And this would be in the red light spectrum and in the 600 nanometer spectrum, as well as most of the panels will also include near infrared. And so they're in the 800 to 900 nanometer wavelengths. Red light therapy is shown to decrease that time in that inflammatory or agri-inflammatory state and improve times to healing. Powerful stem cell activation because of the red light therapy. So that's pretty fascinating. And when we're doing our therapies, if we have more stem cells in the peripheral blood and activated, they're energized, obviously energy-based medicine, you're gonna have a better chance of healing, better outcomes, both short-term and long-term. So that's fascinating. And pretty much in our entire patient population with a minimal side effect profile and a relatively low cost. In all those different ways, red light therapy can be activating, it can be energizing, it can help with nerve function, nerve healing, neuropathies, and cell therapy activation, so the stem cells are more robust, they're more numerous, and they're able to do their job in a better way. It helps with reducing inflammation and pain, so it's a little easier process to heal. It stimulates stem cells, so we have more stem cells circulating in the body, so there's more healing cells. So we get a better, quicker, less painful healing response. How we see implementation of this therapy is that at minimum 2 weeks prior to the injection therapy or the treatment, you would get exposure to a red light, and you'd have that at home and over the area of interest, and especially for harvesting from, say, the bone marrow or fat in the back, that we would have that exposure. You'd be sitting with your back to it and get 15 minutes of light exposure every day. So another important piece of this is the consistency. So one is the time, one is a good quality panel that has the right wavelengths, and the two is just consistency, that you want to get in front of that on a daily basis. After that exposure, an hour later, they redrew blood and they counted the stem cells and noticed a 300% increase in the stem cell count that lasted several days. So right after therapy, if you're using red light, just the area feels better. It's going to continue to help healing. It reduces inflammation, it reduces pain. It's something that could be integrated in your wellness practice. So something that you do every day for life. One of the coolest things about red light therapy is that you can have a very nice, powerful device at home. You want a good quality device. I've been using it on a daily basis. I have a machine or a panel at home, and I sit in front of it. As most of my patients know, I suffer from some chronic low back issues. I've had regenerative medicine, and it's completely changed my life. So it's something that's been really beneficial. I've noticed tremendous benefits, anecdotal. There are lots of studies out there, but this is our own personal experience. The other benefit of having a panel at home is that it's been used by my entire family. They have various aches and pains. We have 5 children. There's 4 or 5 athletes there that are working out and getting injured, and this has been something that they've kind of gravitated towards and have seen significant benefit with the skin health of a 60-year-old with acne, to others that are suffering from joint injuries. So that's one beautiful thing, is that these panels are relatively inexpensive. You're able to plug it into a normal wall outlet, and it's a passive, so you can sit in front of it and get exposure, and something that we'd want to get exposure to almost every day. So 15 to 30 minutes of exposure is a very safe exposure, and it's going to promote cell healing around a therapy, but also wellness long term.